Blood flows through the vascular system due to pressure, generated by the heart and maintained by the elastic tissues of the artery walls. This contraction of the heart forces blood out of the left ventricle into the aorta, branching into various arteries and carrying the blood to the various tissues. This contraction phase of the ventricles is referred to as systole. Hence, the upper blood pressure reading is designated as systolic blood pressure. The relaxation phase of the cardiac cycle is referred to as diastole. Thus, the lower blood pressure reading is referred to as diastolic blood pressure. Blood pressure is commonly measured by the indirect oscillatory method, based on the correlation between blood pressure and arterial sounds. The oscillatory method involves using a rubber bladder within a cloth cuff, wrapped around the upper left arm.
And I'm going to inflate the cuff.
The pressure cuff is attached to a sphygmometer, and a stethoscope is applied to the brachial artery medially above the elbow. When the cuff is deflated, there are no arterial sounds because the blood traveling through the arteries travels in a smooth, laminar fashion. The term laminar means layered, and thus the term laminar flow is used because the blood in the central axial stream moves the fastest, with the blood flowing closer to the arterial wall moving more slowly.
Okay, well now I'm just going to palpate your brachial artery.
The laminar flow that commonly occurs in the arteries is smooth and silent. However, when the artery is pinched, i.e. the inflation of the blood pressure cuff, blood flow through the constriction becomes turbulent, causing the arteries to produce sounds, similar to the sounds produced from pinching a garden hose. The constriction of the artery using the pressure cuff is opposed by the pressure of blood flow within an artery. Thus, in order to constrict the artery enough to cause turbulence, i.e. a sound, the cuff pressure must be greater than the diastolic blood pressure. If the cuff pressure is also greater than the systolic pressure, then the artery will be pinched off and no sound will be heard. Turbulent flow and the corresponding sounds are only produced when the cuff pressure is greater than the diastolic pressure but less than the systolic pressure. When blood pressure is taken, the pressure cuff is inflated to produce a pressure greater than the systolic blood pressure. Thus, the artery is pinched off and silent. The cuff pressure is then decreased by releasing the air from the cuff. When the cuff pressure is equal to the systolic blood pressure, a tapping sound will be heard, and represents the first Korotkov sound, which is due to blood passing through the constricted artery in a turbulent manner. They are named after Dr. Nikolai Korotkov, a Russian physician who described them in 1905 when he was working at the Imperial Medical Academy in St. Petersburg. Korotkov sounds will continue to be heard at every systole, or ventricle contraction, as long as the cuff pressure is greater than the diastolic pressure. When the cuff pressure is equal to or less than the diastolic pressure, the sounds will disappear as laminar flow resumes. Therefore, the pressure at which the first and last Korotkov sounds are heard represent the systolic and diastolic pressures, respectively. Clients should be seated for at least 5 minutes in a chair, with their backs supported and their arms bared and supported at heart level. Clients should refrain from smoking cigarettes or ingesting caffeine during the 30 minutes preceding the measurement. Choose the appropriate size of blood pressure cuff and apply the cuff to the client's left arm. Remember that the cuff must fit properly to ensure an accurate reading. Wrap the cuff firmly and smoothly around the left arm with the lower margin 2 or 3 centimeters above the antecubital space. The arm should be comfortably supported at an angle of 10 to 45 degrees from the trunk, with the lower edge of the cuff at heart level. The stethoscope should be positioned so that the earpieces point forward. Before inflating the pressure cuff, palpate the radial artery with the second and third fingers. Inflate the cuff to a level of 20 to 30 millimeters of mercury above the point where the radial pulse disappears. This is called the radial palpatory pressure. Quickly position the diaphragm of the stethoscope over the brachial artery. Apply a minimum amount of pressure so as not to distort the artery. The diaphragm should be in complete contact with the skin. The stethoscope should not touch the cuff or its tubing. Release the cuff pressure at a rate of approximately 2 millimeters per second. The systolic pressure is determined by the first perception of sound, first Korotkov. The diastolic pressure is determined when the sounds cease to be tapping in quality and are fully muffled. Deflate the cuff to 0 pressure. Record the resting systolic and diastolic pressure to the nearest 2 millimeters of mercury. According to the American Heart Association 2005 scientific statement, normal blood pressure has a systolic blood pressure less than 120 millimeters mercury and a diastolic blood pressure less than 80 millimeters mercury. Pre-hypertensive blood pressure has a systolic between 120 and 139 millimeters mercury and a diastolic of 80 to 89 millimeters mercury. There are 3 stages of hypertension. Stage 1 has a systolic between 140 and 159 millimeters mercury and a diastolic between 90 and 99 millimeters mercury. Stage 2 hypertension has a systolic pressure between 160 and 179 millimeters mercury and a diastolic pressure between 100 and 109 millimeters mercury. Stage 3 has a systolic pressure greater than 180 millimeters mercury and a diastolic pressure greater than 110 millimeters mercury. These blood pressure guidelines are based on individuals who are not currently on heart medication and relate to an individual's blood pressure at rest. Heart medication will affect resting blood pressure and exercise will alter blood pressure. Therefore, other guidelines and standards will need to be used in those situations.